Okay, I think we'll get started while there's just a few people still joining. Good morning or good afternoon, evening, wherever you're joining from. My name is Amy Savage and I'm a technical officer in the Climate Change and Health Unit at WHO headquarters. And I'm very pleased to welcome you to our first technical webinar in the technical webinar series that we'll be running over the next few months, covering a range of climate change and health topics. So today we'll be looking at getting started with conducting a climate change and health vulnerability and adaptation assessment. Before we start, just a little bit of housekeeping. As I'm sure you're aware, we have 2 sessions today, and for all our technical webinar series, we have one in the morning and then we have one in the afternoon at 3 p.m. Geneva time today. So the content will be the same. So if you're here now, no need to join the session this afternoon. There we go. So today we will have simultaneous interpretation this morning in French and Arabic, and this afternoon we'll do French and Spanish. So if you're using the interpretation, you can set it up now. Have a quick look at the instructions here on the screen. So we have set up this event as a meeting rather than a webinar set up in Zoom so that we can have a little bit more interaction, particularly during the breakout sessions. But there are a lot of us here, so I do ask you to please remember to stay on mute if you're not speaking. And please feel free to use the chat and the Q&A, and we'll attempt to respond to you during the session. If not, we can follow up as needed. Also to note, we will be recording the plenary sessions, and we'll put those on the WHO website for those who were unable to make the session. We won't be recording the breakout sessions though. So here you can see the agenda. In a moment, we'll hear from Dr. Diarmaid Campbell-Landrum, the head of the Climate Change and Health Unit here in WHO headquarters. We'll then hand over to my colleague, Dr. Carlos Corbalan, who'll be getting into the content of the session on getting started on climate change and health vulnerability and adaptation assessments. We'll then hear about Indonesia's experience in conducting their vulnerability and adaptation assessment from Dr. Perdanan, who was a WHO consultant who led the VNA in Indonesia. We'll have an opportunity to break out into smaller groups so that we can discuss and share experiences on what we've heard from the presenters during the session. And finally, we'll come back to the plenary. We'll be able to hear from each of the different breakout groups, and then we'll summarize and close the session. So I'm now pleased to hand over to Dr. Diarmaid Campbell-Landrum.
Thanks so much, Amy. It's a real pleasure to join this meeting. I'll just take a couple of minutes of your time, just to underline the importance of not only the topic, but this webinar series or this meeting series. I'm actually quite pleased it's being presented as a meeting with interaction, because this is certainly an area where we're supporting the development of a community of practice, and we're as interested to hear from you as we hope that you are to hear from WHO. But just to quickly underline the importance of the issue, I may not need to do that, because if you're here, you know just how important climate change and health is. But from the importance that WHO is placing on this issue, for our next global program of work, our 5-year program of work, which we see as an agenda, not just for WHO as an agency, but for all of global public health, we have made climate change and health the top priority out of the 6 priorities that WHO is supporting and encouraging member states to support over the next few years. And absolutely central to that, the top priority is protecting people's health from the impacts of climate change that are already occurring and which we know will worsen over the next few years. And the first step in that is carrying out a good vulnerability and adaptation assessment to get a good comprehensive assessment of what the challenges are that climate change is presenting and will present to health, and then to look at the options for adapting to that. So this is part of a much more comprehensive program of technical support that WHO has developed. In fact, over about 30 years, we've been building up our technical knowledge on this issue, and also our experience in working with countries in order to support a comprehensive health approach to climate change. And this webinar is the starting point for that. it's the starting point to us to understanding the problem, and which we can then support countries through developing their vulnerability and adaptation assessment, developing a really good adaptation plan, and then working with countries to get the technical and financial resources that they may need to support that. So we absolutely see this as a journey that we will take together, basically sharing the knowledge that we have, but also, as I say, hearing from you as well. So we do encourage you to stay tuned, to participate in the discussion, not just in this session, but in future sessions as well. With that, it's a great pleasure first to thank Amy and the rest of the team who have put this this program together. And it's a great pleasure now to hand over to Dr. Carlos Corvalán, who will be moderating the session. And many of you will be aware that Carlos is billed quite humbly as a consultant to WHO. He is actually one of the longest standing experts on climate change and health, including working with countries around the world. Can I just check you're there, Carlos, and that I can hand over to you?
Yes, can you hear and see me?
معقول عشان السماعات
اعطيني السماعات والله هي رولر.
We can hear you so far, Carlos. Still waiting for the visuals.
Okay, but I have my video on, so
Are you able to share your screen, Carlos?
Anyway, I think Carlos may have left and then presumably be rejoining in order to address any technical issues and make sure that we can see him and see his presentation as well as hear from him.
can you see me and hear me now?
Yes, we can.
Yeah,
We have you now,
unfortunately, something happened to my computer. I changed to another computer, but my presentation is not there.
Would you like me to share the presentation, Carlos?
We're gonna have to do it that way. I'm sorry, because this is so embarrassing. But anyway, I can continue with this other computer if you have the presentation for me, okay?
Yeah, I'll just share it.
Well, as we continue, so I think dear Amit introduced the topic for us, and he also highlighted that this is one very important tool. Of course, it's not the only tool that we have.
I think we've lost you again, Carlos.
So Amy, can you confirm, please, again, that you can see me, because this, I think I may have.
Maybe turn off your video and just, you're on mute now though. Oh,
Okay. So you can scan this with your phone and you're gonna come up with this document. And many of you would know a previous version of this document.
Carlos, your audio is not very good. It's cutting out.
So this the original document was published in 2013, but was updated in 2021. So more than 50 countries have been using this tool in the past. And we hope that you now hear about the tool, how it has been modified, so that in the future, everyone will use this guidance. Next, please. One more, just to show everything. Yes. Okay, so this is telling us what you will learn, not at the end of this module, but at the end of the series, because as you understand, this is the first of a set of webinars, and the vulnerability and adaptation assessment work is too long to have it in just one session, so there will be other sessions, and we will be covering all these topics over the sessions. In this one session, what we want to do is really teach you the initial steps, which are perhaps the most important, because if you get this first step right, you would be able to complete easily the other 6 steps. Next one, please. Okay, so what you see here on the bottom right is a picture of the cover of a very recent document. It was published at the end of last year. It's called the Operational Framework for Building Climate Resilient and Low Carbon Health Systems. And you will recognize probably the title of this document, because it also is an update of an older document published in 2015. But it has been increased in its scope by including low carbon, and also by improving its contents by everything that we have learned in the last 10 years in this topic. So this framework has 10 components. One of them has to do with assessments of climate and health risks and greenhouse gas emissions. And within this, there's one component that deals with vulnerability and adaptation assessment. And the aims is to assess the current and future vulnerability to health risk of climate variability and change, and the policies, programs, and capacities of health systems that could help us to increase resilience. Next, please. So this is a little bit to understand
100% understand that, but unfortunately,
what we mean
I'm not
by vulnerability and vulnerability factors. And there's a reason why we have this picture there, because it would help us to understand, unfortunately, in a very extreme case, what we mean by vulnerability factors and how vulnerability factors overlap. It's not that people will suffer one or two, but sometimes they suffer from all of them. So starting from the top right, if you look at biological factors, what vulnerability factors we could find in this setting? Probably there will be pregnant and breastfeeding women. There will be undernourished populations. You may find populations with high infections of infectious diseases. When we speak of demographic factors, we could probably think of age group, and we would say there may be a lot of at-risk children and babies, and there may be some population dynamics involved. Like, for example, there could be people that had been relocated or forced migration. When we think of geographical factors, we're thinking of unplanned urban housing or flood risk zones or an area with a food insecurity. When we think of socioeconomic factors, we would be looking at poverty, unsafe informal occupation, unsafe water and sanitation, inadequate shelter. And finally, with sociopolitical factors, we may have discriminated minorities, people without information, people without a voice, etc. So all these factors overlap in a population. And on top of that, we see the impacts of climate change on top of these vulnerability factors. Next, please. So to enter into the topic of the vulnerability and adaptation assessment, it's important to understand that there's not one way to do a VNA assessment. We do encourage definitely that this is a participatory process. It has to involve as many people as are necessary. And very often we think of people that are the specialists on the one side from Ministry of Health, all the way to the communities that are actually affected by climate change. Then there are different goals and timeframes, and that will depend on how you want to conduct the assessment. And all this will be clear when we go through the steps. There will be different varying time periods, because you can do an assessment thinking short term or longer term. There would be definitely a very large and diverse number of stakeholders, or could be very few depending on the scope of the work that you're doing. You can do it with a lot of money or a very small budget. And of course, the bigger the budget, the better and more comprehensive the work you can do. And you can follow methodologies that are just qualitative by taking local and experts' understanding, or to quantify the situation so that you're trying to measure and make it more comprehensive and detailed. Next, please. So here what we have in front of you is the 6 steps of conducting a full VNA assessment. So we're going to look in detail at step 1, which is the planning, where we get started, where we set up the base of everything we're going to be doing. Then on step 2, we get into more specific detail on how you run a vulnerability assessment. In step 3, how you would assess the capacity of the system in front of climate change. The step number 4, a very important one, because and very difficult sometimes, because we want to look at the future of the situation. Where are we now on one hand, but where are we going to be in 5, 10, 20, even 30 years' time? Then we would do, once we understand all that, we would do what we call the adaptation assessment. So what are the specific actions we're going to take now that we understand our vulnerabilities in order to adapt? The last step is a synthesis of everything. And this synthesis will be very useful for decision makers, because it would help us to build an adaptation plan for the country. And this could fit into the national adaptation plan that other sectors are doing. So it's the whole process. It's not something that will be done overnight. It takes time. I think we're going to hear from some experiences of how long this takes, but it can be done comprehensively with the staff that we have and within the budget that we manage. So it's not something that is impossible. It's not something that you say, well, we don't have the expertise, we don't have the money, therefore we cannot start. And what we would say, you can start small and then move big as you go. And this comes clear in the steps. So we can go to the next one, please. So these are the 6 steps within step 1. So let me go through this. We're going to go in detail, but let me put you in context by reading this. So in the first step, what we want to do is to establish the project team. And we also have a management plan. And this includes, as we said, some people from the Ministry of Health. We want this to be managed ideally by the Ministry of Health, and with different departments and ministries of other sectors. In the second step, we need to identify the questions that we want to answer and what is the policy context in which we're working. In the next one, we start defining the health risks, the outcomes we want to consider, the geographical region we want to focus on, the time period, etc. Then in step D is when we establish the process for the stakeholders. So who is going to be involved? And this, we always say, it should include the population that could be affected by the problem we are trying to consider here. And then we identify the sources of information and data that could help us to shed light on what we want to assess. And then we come to develop a communication plan that will be used throughout the assessment to inform both decision makers and communities interested and involved, affected by the problem. Next, please. So we start with this, the first step. So we want to establish both the team and the management plan, and it's highly recommended that this is run by the Ministry of Health. Sometimes the Ministry of Health will not be able to carry out the assessment, but the ministry will be able to lead the process and allocate another group, could be an academic institution, an NGO, a set of experts to run the process, but always with the leadership and management by the Ministry of Health. So the management plan will define what the scope of this work will be, what the goals are going to be, and what experts we should involve, and it would include defining the timelines, the role, responsibility, budget. And then there will be perhaps one or two project teams assigned. One would be a team of core members that will accompany the project throughout its duration, but you will also need to bring in an extended group of persons that would help you in different aspects of the problem. So, for example, you may need, depending on what you're studying, what you want to resolve in your VNA, to have a statistician, an epidemiologist, vector-borne disease specialist, entomologist, meteorologists, so people from diverse sectors that would help you to understand the problem that you have and to come up with the solutions in the long run. Next one. Next one. Yeah. Okay, so in this step, we want to identify the questions to be addressed and the policy context. We would need to understand the Ministry of Health's priorities. We would need to collaborate and have a working relationship with our stakeholders, determine the resources that we have. When we choose the appropriate questions, here we have examples of things that we would want to ask, like which populations and regions are most vulnerable, and which other vulnerability factors that we are not looking at could determine vulnerability. There's issues of cost and benefits of if we change policies. So there's many questions that we can set up very early in the process. Next, please. So we would also be concerned about looking at three things: the health risks, health outcomes, geographical region, and time period. So this should be defined early on. For example, when we think of the health risk, we need to have a specific set of stakeholders, experts that could help us. When we think of geographical scales or geographical region, the next one, please, we would be thinking at whether we want to do this in a small place, the whole country, and this will depend a lot on the resources and the time frame that we have. And then we think of the time period. We will be looking at defining whether we want to do this to time with our health plans, which would be 5 or 10 years, or be more ambitious and look at more at what climate change time periods in which things could change over the longer term, for example, 30-year time periods, especially when you're thinking on towards the future. And of course, next one, please. You would need to consider what other factors may change vulnerability now or in the future, like a rapidly developing economy will have a different set of vulnerabilities today than in 20, 30 years' time. There will be changes in population, there may be migrations, etc. So we have to think outside the box when we consider other factors that affect vulnerability. Next one. So in this step, we want to look how you would establish the stakeholder process, and the stakeholder representation would include the different health programs, the different organizations or institutions that know about climate change, not necessarily about climate change and health, but climate change and health, for example. We need to involve policymakers, whether at the national level or at the local level, depending on what we're doing, or both ideally. And of course, we want to have the communities and vulnerable groups that will be affected by climate change and by the policies that will come out of this. So, yeah, thank you. So what we need to do is also identify all the information and data sources that are relevant to the work we want to do. So, of course, people go immediately into peer review literature. So what has been published in journals. But we also have a very rich set of information in gray literature. So these are reports that have never been published, or they were published by an NGO, by the government, in academic theses, etc. Then we need community reports. So these are reports that may have been done for specific reasons, looking at cultures in the community, anthropological issues related to the community, if they exist. Then we need several sets of data. We definitely need health data, which the Ministry of Health would probably have, or we'll need to negotiate within departments to make this data available to the team. And also, you need climate data, which is outside the scope of what the health sector can obtain. So you need to go and form partnerships with other sectors. Of course, vulnerability factor data also come from both within the health sector, but also mostly from outside the health sector. Next, please. Finally, we want to develop a communication plan. And the communication plan, as we said earlier, can have many forms. And I think this is very important. So you can have executive summaries, infographics, presentations to the community, to decision makers. You can have newsletters, definitely social media, and many other ways of informing both community, the process, the people engaged in the process, and importantly, decision makers. So there's a communication plan that needs to be developed. It needs to think on what are we going to have in that communication plan, how we're going to deliver it to decision makers, to the communities, how timely they should be, whether stakeholders are all going to be contributing, who's going to be contributing to the plan, et cetera, et cetera. So having said that, next one, Amy, please. Well, of course, yes, we need to share results. We need to show, well, what is importantly is that by communicating the plan to everyone, it's an open process. So the VNA is not an academic closed process or a Ministry of Health closed process, but an actual open process in which we engage everyone. And most importantly, by being open, we give credibility and legitimacy to the whole VNA. Next, please. Oh, okay, so with this, I leave you back with Amy, and sorry about all the problems we had initially.
Thanks so much, Carlos. That was great. I'm really pleased now to introduce Dr. Ferdinand from Indonesia, who led Indonesia's climate change and health vulnerability and adaptation assessment. He'll be talking about their experience in planning their VNA. So Dr. Ferdinand?
Yes, thank you very much, everyone. Can you hear me, Amy?
Yes, very clearly.
Yeah.
Thank you.
Thank you very much also, Carlos. So actually from Indonesia, we just follow up what Carlos explained about all the steps for the climate resilience on the basis of WHO guidance. So we follow all the steps carefully and then do some validation actually in some areas of Indonesia. So I'm gonna share you Indonesia probability and adaptation assessment. So we just take a note all the steps that already explained by Carlos, so it's helped me a lot, so I don't have to repeat about it. Climate change and health probability and adaptation assessment from WHO. So all the presented materials in this opportunity is based on the development of health adaptation strategy through probability and adaptation assessment that we conducted in 2022 up to 2023. So maybe specifically we're gonna discuss with you guys, share with you about how we do it. So objective of VAA in Indonesia is to enhance the evidence and understanding of the current relationship between weather and climate and health outcomes, provide information to health officials, stakeholders, and the public about the risk, existing risk and the future risk, including population most vulnerable, and then identify opportunities to integrate climate change issues into existing policies and program, serve foundational analysis for monitoring future changes in risk policies and program. That's why actually we also develop a portal, web-based portal, to consolidate the output of this assessment. So it's not just as a book. And then the last one is foster collaboration with other related sectors such as water, infrastructure, to further promote activities to improve population health in changing climate. So this is the methodology. There are many steps. We plan the assessment, and then we conduct the probability assessment, capacity assessment, future risk assessment, and then how we do it in detail using the mathematical formula that we created on the basis of IPCC model concept of risk, and then we synthesize the assessment. Everything is already explained by Carlos. The ones that maybe we also adopt is the Indonesian National Focal Point on Climate Change, which is the Ministry of Environment and Forestry. They already have the guideline how to conduct climate risk assessment. So we also try to consolidate based on not only the WHO framework, but also what is already available in Indonesia. So we can advocate the government not only from the international standpoint, but also from the national perspective. So we do the analysis at the macro, meso, and micro level. There are a number of indicators. As you can see, we use 15 indicators, 27 sub-indicators, and 74 data to fill in all the indicators, how we do the assessment. So for the micro level, the analysis was applied to 84,096 villages, so covering all over the Indonesian country. So the assessment start by forming the VAA team containing of Ministry of Health of Indonesia, particularly Climate Change and Environmental Disaster Adaptation Working Team, WHO Indonesia, Health and Environment Unit, and the PRA Environment and Technology as a WHO consultant for the VAA to help how to do the work. So this is the detail, the form of the VAA team that's involved the multi-stakeholders, Ministry of Health here as the center of the work to do the coordination with different supporting ministry as we need many data for this one that is supplied by them and also their perspective, how we can measure the climate risk. And then we also consolidate with subnational government, provincial and district government, in particular DKI Jakarta, Riau, Yogyakarta, Rokan, and Bantul. Many of you might not know, except maybe DKI Jakarta as our capital city. And then the technical team will do all the technical stuff and substantial input we get from the universities in Indonesia. And then WHO Indonesia also not only from one division, but also a number of division, how we can get their information, and also non-governmental organization, international NGO, national NGO, blah, blah, blah. And if you see, there are a couple of arrows explaining how we work with different multi-stakeholders. For example, when we want to define the best practices to develop the climate change adaptation strategies for the health sectors, we get some input from non-governmental organization. And also supporting best practices and target, they're gonna provide the ones that also already promoted by Ministry of Health. So we combine those things. So technical team PRA actually consolidate the input from all the multi stakeholders that is engaged in the development of VAA in Indonesia. We also use some key question to establish the context, coverage, and period. As you might notice, the work is done for all over Indonesia, containing 84,096 villages, which is required huge data set. We develop, as I explained before, in the methodology, PCC guidance as well, and etc., etc. The key question related with health risk and outcome sensitive to weather and climate, how it responds in Indonesia, and then the current burden of climate sensitive health outcomes. We do the literature review, FGD, etc., to get this response. Other factors determine vulnerability of population, the burden of climate sensitive health impacts, additional public health intervention for effective risk management. So we consolidate and compile all the input following all the steps that already explained by Carlos previously. So here is the data set that we use. There are many data, actually. That's why we show you in here much more indicators, because from one indicators that could be 2, 3 data set composing the indicators. So we define the component based on the IPCC guidance, how to conduct risk assessment, the sensitivity, adaptive capacity, exposure, and hazard. So this is actually make much more detail from the slide that Carlos explained about different components, how to measure risk and probability in a particular areas, location, or region. So based on the indicators, then we identify required data set, and then this is the source of data. That is multi-ministries, including some NGOs, for example, AMAN. AMAN is actually for indigenous data set that is collected by AMAN. So we try to collect, compile all the data from different sources. And then how we get the data collection for village statistic, we purchase from the Bureau of Statistics of Indonesia. And a couple, we download the data from the internet, like climate data, biophysical, health profile, socioeconomic, some observed data set. Also, we download from BMKG website. This is the National Bureau on Meteorology and Climatology of Indonesia. And then we do some interview and FGD to get much more nuance about what's going on in the field. Also, we want to ensure the policy, regulation, and program from national to a specific areas is consistent or relevant. We do some coordination for a number of requirements that we can that is needed for conducting this assessment. And if you want to know who they are, this is the stand for of BPS, MOH, and etc. So the communication design, how we communicate with the different stakeholders, the mode of communication, the media we use, we try to synthesize or summarize in this table. There are a couple of activities: kick-off meeting, consultative meeting, FGD and workshop, and expert consultation. The audience is, as you may notice, is a different stakeholders. WHO, PREA, MOH, ministry, agencies, provincial, and NGO is invited for the kick-off meeting. So we started by getting more information even from the start of the project. So info project team is advisor, operational team, and technical team. The goals is introduce the project to stakeholder and manage expectation and set the goals. This is just one-time event with the format of meeting. We need some instrument, project charter document, and a presentation. And then we have the weekly meeting for consultative meeting with WSO country office, regional office, and headquarters. The area as the technical team and Ministry of Health. What is the goal? To review the status, manage performance, and clear issues. The FGD and workshop, where we do in the format of meeting, breakout room discussion, and presentation, is to discuss current activities and maybe try to solve the problem that we are facing. In particular, obtaining the data set, validating the result, because covering the entire country, Indonesia has 3 time zones, so it's quite huge country. And then we have 1,000 of villages. So we need to ensure at the minimum the method that we develop can capture the pattern and if possible also the magnitude how it works in the field. Also, non-government, NGO, CSO, private sector, and university are invited during the FGD and workshop. The last one, we do expert consultation, technical team and core team. This is for review status. And also we do it tentative whenever we see there is some issues that we need to discuss. When we visited a couple of areas, we also try to do some validation how we do the assessment, the result of the assessment. And we also use some questionnaire to measure the resilience system of that area. So we can get much more comprehensive information as we did this kind of resilience health system analysis, the qualitative one following the WSO guidance in the form of questionnaire, starting from national up to the local level. And then we consolidate the qualitative analysis with the quantitative analysis, because we have the data for the entire villages. Whenever we found there is some missing data set, we try to use statistical analysis to fill in the data and then validate the result. So we can combine the qualitative and the quantitative analysis to really provide us how we understand about the current and future risks, and then how we formulate the climate change adaptation strategies for the country. I think that's all from our side, because the request is more how we do the VAA in Indonesia. If you have any information, you can shoot me an email or WSO Indonesia, Bu Neni. Thank you very much. Get back to you, Amy.
Thank you very much, Dr. Padanan. That was very interesting to see how you and your team managed to take the WHO guidance and implement that practically in the context of Indonesia. And now we have the opportunity to interact a little bit more and share our own experiences and learn from each other in some small group sessions. Just give me a moment. I'm going to share my screen. Okay, so we have 4 breakout groups on the different aspects of that first step of the VNA assessment process that Carlos and Dr. Perdanan have spoken about. Please note that the interpretation, unfortunately, in Zoom doesn't work in the breakout rooms. So if you need French or Arabic interpretation, that will only be in the main room. So we'll have one of the breakout rooms here in the main room. So if that's you or you're interested in this topic, please don't select a breakout room, just stay here. Each of the 4 breakout rooms will be facilitated and cover a different aspect. So in the main room here, we'll be looking at that stakeholder engagement process and communication plans. In the next breakout room, we're looking at how to establish the project team, who we need on that, what other stakeholders to engage. Breakout room 2, we'll be exploring the different aims of VNAs, the questions, research questions that we might ask, and the policy context. And in the last breakout room, we're looking more around the scope, the different health risks that could be covered, geographical scope, and then the data sources that we would need for that. So now my colleague Christina will open the breakout rooms. You're free to just select whichever one you're most interested in. We'll have about 25 minutes and then we'll all come back to plenary to share what we've discussed. So Christina, great.
Okay, so I guess I'll be able to do the summary for the main plenary then. Thank you very much.
Thanks, Lena. I think we have everyone back now, and I would like to hand over to Carlos, if you're there, Carlos, to just moderate this feedback session.
Okay, yes. So sorry about that. So yes, I think everybody finished now. So we're gonna go in the order of the groups. So we started having a group in plenary. Is that you, Lena?
Yes, this is me.
Okay, so whoever is gonna report from your group, please go ahead.
Thank you, Carlos. So actually, I think it's going to be me. So we had a lot of very good contributions to the different pages on the Jamboard. So we were discussing specifically on what stakeholders should be engaged on the VNA process and what would be good target audiences and communication products and objectives for the communication plan of the VNA. So in general, participants have been contributing a lot of different ideas in terms of stakeholders, including different ministries that should be involved, different groups of the population that would be particularly vulnerable to climate change risks. And then experts such as research institutions, universities, and different organizations that would also need to be included in the VNA process. In terms of the importance of communicating, so of course, the importance of coordinating with other sectors was highlighted, and ensure that the VNA is relevant to the local context and to the stakeholders, so that the different stakeholders are really able to take action on the results of the VNA. And in terms of the target audiences and the communication products, so different communication products have been suggested in terms of social media, infographics, policy briefs, different launch events, and even some more creative ideas of doing, I think it was like a different channels and workshops on the VNA process. So we had a lot of creative ideas, and of course, trying to tailor that to the target audiences that have been identified. So that's it for me, and perhaps the next person can report for the next breakout room.
Yeah, thanks, Lina. So I get a feeling that your group understood very well the process that we want to follow in identifying the stakeholders and the communication. So break group 2 is Joe Hobbs.
Yeah, hi everybody. I don't know how long I've got, so I shall try.
Yeah, I'm sorry, Joe, to interrupt you. That the next one to follow is really room 1, because that one was the main one. So was the project team and stakeholders. We should really follow the order of the groups because there's some lodging there. So the next one was I think Antonis, you were in charge of that one. So who's going to present on project team and stakeholders?
Thank you, Carlos. I don't know if our colleague Tito from Timor-Leste would like to go ahead.
Thank you, Mr. Antonio. Okay, let me start on behalf of my group, Group 1. So, good afternoon, everyone from Timor-Leste. So, from our discussion, I just share our experience VNE process in Timor-Leste. So the first we have a core team that we established, WHO and Minister of Health. So then in line minister with Minister of Finance and Minister of Tourism and Environment. Then during the process, we have an inception meeting and discussion among us with expert and Minister of Health how to this process is running. So after that, we set up a plan, and we identified the expert from our local university and also international university like James Cook University and Menzies schools in Australia. Then we have one of local National University of Timor-Leste. So then the expert that we invited come here, and we were identified the local university with the support research team. So when we organized the inception meeting and national workshop, inviting the stakeholders how to start the VNE process. So it is an enumerator itself and some academic others in Timor-Leste. So target from the assessment itself, it's vulnerable groups, health workers, and local stakeholders. And also we have a literature review from our experts. So some aspect for different community and analyze the data collection in the climate sensitive disease data and climate weather data. So I think I over to my colleagues, others colleagues can add more. Thank you so much.
Thank you very much. We're really running out of time, so we're going to go to the next one. That was very useful. So now, Joe, sorry about the previous, but we're all ears.
Okay.
Nice.
So we didn't really have time to order the points into themes, so I've just identified what appeared to be the most frequently reoccurring points. So from the first one, I would say it was perhaps the risk of climate change on sexual and reproductive health, and the capabilities of the health sectors to manage and adapt to climate change. The second one we looked at was the research questions you would want a VNA to answer. And the main points appeared to be, was there particular groups in society that are especially at risk? And how vulnerable are health facilities within healthcare systems to be able to relate and to work within the climate change? And also, what is the adaptive capacity of health systems and communities? And for the final point, it was some of the challenges we see in meeting the objectives of VNAs. And that appeared to be obtaining data, access to data, lack of facilities, and perhaps the technical expertise in doing a VNA, and acceptance and willingness to participate in VNAs, and having those people work across different sectors and to collaborate with each other. I think I've whizzed through those, Carlos.
This is great. Thank you very much, Joe. I will go straight to Amy for the last one, that is define and health and geographical scope and data sources.
Thanks, Carlos. We're lucky to have Adunya to report back. Adunya, just let me know if you wanted to share your screen and I'll make you co-host.
Yeah, host disabled participant screen sharing. Thank you very much. Yeah, thank you very much. While the slides are managed, yeah, there was a large group. We're fortunate enough in having 60 to 80 people. Can you see my screen?
Yes, we can.
Yeah, this is a rich information we tried to provide. So I don't want to go to the details, as we are from different parts of the globe and there is high diversity. We expect these health risks are ranging from heat, vector-borne disease, and a lot of things are mentioned. And similarly, climate hazards are also flood, drought, extreme drought, hail, a lot of things are mentioned. So moving to what things are influencing what we are trying to do, expertise, availability of data, all those are very important areas. How can I move my slide? Yeah, I'm trying to move my slide. Yeah.
I think there's some arrows on the right-hand side under where it says 1,
Yeah.
4. Yeah.
Yeah, these are the potential data sources. This is a huge undertaking. It is so expensive. So different participants from various parts of the globe, they have mentioned a lot of data sources, DHS, surveys, World Bank data. A lot of data sources are mentioned, health records, surveillance data. So those are the sources we have tried to map. Coming to the challenges, data not up to date, disparities of data coverage, conflict of interest, a lot of things are mentioned. Yeah, let me try to scroll down. Yeah.
I think that's all we managed to cover in our session. It was perhaps a little bit short to cover everything, but we got a lot of input. Thanks so much, Adunya.
Yeah, we'll try to compile this and I will try to share. Thank you very much. Yeah, over to you.
Thanks so much. We have 2 minutes left, so we're going to try to be very brief in our summary. I hope that this time you can see me and my computer is behaving.
We can.
Yes. So basically, I think this was fantastic for me. It was really great how the groups worked and they understood the process. I think that what I explained originally was really brought to life with the Indonesia Ferdinand experience in Indonesia, because he was able to put the actual work that they did into the explanation that I gave. And I think that was a very fantastic work. And I think that that also highlighted that although WHO has the tools, they were also able to look at other sources of information and methods. So they went through IPCC, etc. So all that is very important, because we're not saying that you have to follow one strict form of doing this, but we need to be flexible. And I know from the work that they did a lot more than what a VNA aims to do. For example, they did very detailed cost of action and inaction, because I saw their report. So that gives us an idea of how this work can be done. So the groups really were amazing, because you were able to come up with really the key issues that we would consider when we do a VNA, and this is just by participating in one quick webinar. So obviously you can understand that this is doable. And if you are able to download and study the guidance, you're going to see that there's a lot more explanation there and more examples, and would guide you all the way in the process. So you're all able now to become, I hope, members of a team in your country that would be able to conduct this. So just to remind you, Amy probably was going to do the same, that there's going to be more webinars like this that continue the process. And someone in my group asked about health facilities. There's also a specific webinar that will be looking in detail at a health facility. So having said that, I'd like for Amy to close the meeting. Thank you.
Thanks so much. Thanks, Carlos, for your presentation, for the great summary. Now we're a little bit over time. I am going to finish just with a quick Slido question, just one, and I will leave it open in any case after we close the meeting. So while this is loading, you can either go to slido.com and put in WHOCCH as the code, or scan this QR code. I'll leave it there for a moment. And the question that we're asking is, what are your key takeaways from this session? Have you learned anything new? Is there anything that you'll take back and use in your VNA process? Or is there any action that you'll now take away and start to implement to get started on your VNA? We'd be really interested to hear about this. Because we are at time, I will, if I can find my mouse, move on to the next slide. So I won't show the results, but we can certainly share those. And I did want to finish, just as Carlos mentioned, that, and as I mentioned at the beginning, this is a webinar series. So we've covered just the first step of the VNA process in this webinar. So this QR code just has the link to the schedule. You can see the schedule here. The next webinar we're conducting will be next week. And we're looking at accessing funds from the Adaptation Fund for Climate Change and Health, and specifically with WHO as an accredited implementing entity. But please do let us know if there's any topics that are not on this list, this schedule, that you would like to have us cover. And we really look forward to seeing you again in future webinars. And I thank you very much for your attention and your engagement, and we'll see you soon. Thank you.